Hello everyone, welcome to my YouTube channel. My name is Toluse Francis, aka The Mentalist. If this is your first time on my channel, please don't forget to subscribe, like the video, and also share with friends. But if you have subscribed before, please share this video you're about to watch, and also click on the like button. And if you have questions, just drop your questions and definitely attend to them when I see them. Thank you. Today we look at inferiority complex. Now, overcompensation can lead to the development of an inferiority complex. This is a lack of self-esteem that defines inferiority complex, where the person is unable to rectify his feelings of inferiority. Now, remember that in the previous video, I talked about this idea of feelings and how we seem to be born with either the inferiority or the superiority complex feeling, and how in a bid to satisfy this, there comes the theory of compensation and weakness, or compensation and the likes. Now, according to Adler, the hallmark of an inferiority complex, the hallmark of an inferiority complex is that persons are always striving to find, a situation in which they are satisfied, in which they excel, in which they succeed, in which they make a headway. Right now, this drive is due to the overwhelming feelings, of inferiority. Now, you can feel inferior and you may actually be inferior. So here we're looking at feelings, right? Not necessarily the fact that it has been certified that this person is inferior, but we're actually looking at that feeling of inferiority that the person experiences, right? And this can come at any point in our lives, okay? Now, there are two components of these feelings of inferiority. So come with me. There is a primary component and there is a secondary component, right? Now, primary inferiority is the original and normal feeling of inferiority that we most times, maintained as infants. More or less like we are born with it, from infancy. It grows up with us. Now, this feeling is productive, as it provides motivation, for us to develop, the child now to develop and become that person in terms of growth, in terms of maturity and other things, Now, because it came from infancy, then it becomes good. But the secondary inferiority, on the other hand, is not as productive as the primary inferiority. Right now, secondary inferiority is the inferiority feeling in the adult, which results when the child develops as an adult. And the child develops as an adult with an exaggerated feeling of inferiority. So you get my point now. So the primary is the one that comes with us as infants, but as we grow, then you have the secondary. Now, these feelings in the adult are what is harmful, and they comprise the inferiority complex. So we've looked at two components, the primary and the secondary. Now let's now define what inferiority complex is all about. What exactly is inferiority complex? Now, an inferiority complex is a psychological term used to describe people with intense feelings, of inadequacy. Oftentimes looked at from the angle of low self-esteem. So it's often resulting in the belief that I am not enough, in the belief that in some way I am deficient or inferior to other people, either around me or those that I am trying to pattern my life towards. So inferiority complex in itself is when you find yourself at that state where you feel like you're not enough, you feel like everybody is better than you are. The experiencing inadequacy at times is completely normal, and sometimes it can even encourage us, to strive, to improve ourselves, to grow in terms of developing ourselves. And it's human to feel a bit inferior at times. It's very human. If you feel inferior once in a while, that's not a problem. And in fact, it can be necessary that you feel that way once in a while. And then it humbles you, and then you're able to get yourself going. After all, if you don't make mistakes and learn from them, how do you even become a better person? How do you grow? How do you improve? How do you scale through the hurdles that you find yourself having to scale through, especially in the workplace? So sometimes these feelings of inferiority can help us be better persons. However, feeling inadequate might lead some of us to become consumed, right, by an all-encompassing um, excuse me, sense of failure and low self-esteem that leads us, all right, to not appreciating who we really are. That leads us to rumination or to self-deprecation, where you bring yourself very low and consider yourself as not being enough or not being worthy of anything. And again, like I said, although sometimes feeling inadequate can actually push us forward rather, but then we also need to realize that there's a need to draw a balance. All right, so that times you can become stuck in those feelings, and those are not helpful, right? When you get stuck, it's not helpful for you, all right, which then becomes a major challenge or a major issue, a major problem, right, for such a person. Now, if feelings of inferiority seem to take a greater deal or take over your life, all right, and make it difficult for you to function, or makes it difficult for you to accomplish your goals, all right, then there's a problem there. You most likely may be suffering from an inferiority complex. And so at that point, you need to realize that this is not an issue of a minor setback anymore. It is now an issue of inferiority complex. Now, I need to also let you know that although the term inferiority complex is often tossed around to here and there, you hear people saying inferiority complex and all that, especially in pop culture, right? And it is not a mental health diagnosis, okay? It's not a mental health diagnosis, but it's still a real phenomenon. All right, just the way people throw around the word depression without even going through any form of diagnosis whatsoever, right? It's still, depression still exists, but people throw the word around anyhow. Now, those who suffer from inferiority complexes have chronically low self-esteem. Underline that word, they have chronically low self-esteem, often overwhelming, okay? Often overwhelming themselves with self-deprecating comments. I'm not good enough. I'm not fine enough. My hair is rubbish, and they convince themselves, okay? They try to convince themselves, all right, that these reasons and these comments that they make about themselves are reasonable. Now, this phenomenon can be debilitating for those, okay, who experience it than those who just throw it around just because it's a word that they find very interesting, okay, to actually use. Well, how did we come about the term inferiority complex, right? Like I said, Alfred Adler is the father of individual psychology, right? And so he started this journey of inferiority complex. Now, the term inferiority complex was coined at the turn of the 20th century. So let me just what I have. The term inferiority complex was coined at the turn of the 20th century by Australian psychologist Alfred Adler. Now, Adler was curious to understand why people, all right, why some people rather lack the necessary motivations to do things, necessary motivations they need to accomplish what they're to accomplish, especially their goals and their plans, all right, and also laid out his belief, all right, that all are born with some form of with some amount of inferiority complex, right? He believed that some of us have some amount of inferiority, and learned in childhood, that we learn this thing in childhood, okay. And he also went on to say that we all have an inborn drive, right, to overcome this sense of inferiority, okay. But then he believed that, look, the fact that we are all born with it means that we have that drive to also overcome it. Although, or should I say, however, modern day psychologists, all right, have largely strayed away from this concept of inferiority complex, and they have come to pick a more rather mainstream terminology for it, which is what they now call low self-esteem. So instead of saying a person has inferiority complex, in the clinical setting, it is regarded as that person having low self-esteem. All right. So if you hear them say a person has low self-esteem, they are speaking almost in language. They are saying this person has inferiority complex. Additionally, psychologists today believe that full-fledged inferiority complexes, right, aren't just based on childhood experiences. Okay, they have come to realize that they usually stem, all right, from a combination of factors beyond just childhood experiences, and these factors are quite numerous. Several of them. Let me see if I can read I can read some of them to us that we understand that it goes beyond, how would I put that? It goes beyond childhood experiences. You have childhood experiences. Okay, you have experiences we have as adults. So you have childhood experiences, you have experiences we have as adults, unlike Adler's principle of philosophy, we believe that it stems from childhood. So we have personality traits, we have cultural message. So experiences we have as adults, right? And then you have personality traits, and then you have cultural messages we receive about our perceived inadequacy. So these are some of those things that modern day psychologists believe affect us. Now, what are the symptoms of an inferiority complex? So you have insecurity and low self-esteem, inability to reach your goals and feeling stuck, wanting to give up easily, assuming the worst, feeling the need to withdraw in social situations, often feeling down on yourself, talking yourself down, expressing anxiety and depression, being sensitive to criticism, and a host of other things. It's inexclusive. Now, what are the treatments for inferiority complex? Inferiority complex can not only hurt you, but those around you as well. So, additionally, because the development of an inferiority complex can lead to mental health disorders such as anxiety and depression, it's important to seek help if you feel you're struggling with inferiority or find other ways to work through your feelings. So, the first method of treatment is therapy. Psychotherapy is a great place to start when you're looking to work through your inferiority complex. Therapists can guide you through your past experiences with criticisms, low self-esteem, or other traumas that may have shaped your negative self-image. So together, you and your therapist will work to understand what messages you received as a child about your inadequacies and how you coped in the past. You can discuss any damaging thought patterns and brainstorm ways to reshape your self-image and build your self-confidence. These conversations can be difficult, I must tell you, right? Facing some of the origins of inferiority complex is not always an easy path and can make you feel some. But you will realize with time that you're progressing. So keep in mind that many people have suffered this before at some point in their life, and it's possible to feel confident again. So don't give up. Next one is meditation and journaling, right? So in addition to therapy, it can be helpful to try meditation and journaling. Both of these activities can be valuable in helping you get more in tune with yourself. They help you begin to understand more of your thought patterns around your self-image, and where your feelings of inferiority originate. And you can begin to work towards a healthier and more fulfilling, affirming mindset. Next one is selecting your group. Making a conscious goal to surround yourself with more positive and uplifting people can also make a huge difference. Negative or toxic relationships can at times set you up for failure, especially if you're particularly a sensitive person, and you're sensitive to comments from people. So select your group responsibly. So what's the takeaway here? The takeaway here is that everyone has a strength and weaknesses. There is no reason why anyone should feel less confident than others. And the bottom line is that living with an inferiority complex isn't something you have to just put up with. It's something you can break free from, and you deserve to have a healthy self-esteem, letting you live happy, free, and confident again. So go out there. Alright, if you think that you have some of these traits, you feel that you have some of these signs and symptoms within you, ensure you don't just bottle them up. Don't let it dictate how you feel. Go out there and handle it. Till I come your way again, subscribe, like, and share.